Do your legs always feel as heavy as lead, numb, and aching at night? That is your blood vessels crying for help. Try this 15-minute routine now. What are varicose veins? This is a fairly common syndrome affecting the legs, caused by swelling and damage to the inner vein walls. Lower limb varicose veins, also known as leg varicose veins, are a benign condition resulting from a disruption in the venous blood flow returning to the heart. Most cases are due to structural abnormalities in the leg vein walls, often triggered by secondary causes such as age, weight, prolonged standing, or pregnancy in women. Complications of varicose veins. Vein walls have a certain elasticity, so when overstretched, they are very prone to rupturing. If subjected to strong impact or pressure from tight clothing, a ruptured vein combined with an open wound can be truly dangerous. Bacteria can directly enter the bloodstream, causing severe consequences like ulcers and inflammation in the varicose area, or even sepsis. In cases where they haven't ruptured, varicose veins can still cause blood clots to form at the dilated sites. These clots can travel through the bloodstream to the lungs or heart, causing blockages. Blockages reaching the heart, brain, or lungs carry a very high risk of stroke. Therefore, generally speaking, this is a condition with many potential health risks. Additionally, venous insufficiency in the legs often causes pain, aching, numbness, and a feeling of heaviness. This is because blood fails to flow against gravity back to the heart, but instead stagnates in the lower limbs, causing significant discomfort and inconvenience in daily life. Typically, depending on the severity of the condition, a doctor may prescribe appropriate intervention methods. If mechanical interventions like laser therapy or surgery are not required, patients can apply exercises to alleviate the symptoms of this disease. Exercises for people with varicose veins. Since the characteristic of this condition is blood stagnation in the veins, the first step you should take is performing exercises to promote blood circulation in this area. Below are exercises you can refer to. Exercise 1. Burger-Allen. The Burger-Allen exercise. How to perform. Lie on a bed and elevate both legs high. Hold this position until your feet turn a pale white. Next, sit up and let your legs hang loosely over the edge of the bed until the pink color returns to your feet. Then lie down with your legs extended, keeping your whole body in a straight line. Perform this exercise 10 to 12 times. Exercise 2. Heel raises. The heel raise exercise. How to perform. Stand in a normal posture. Raise your heels, shifting your center of gravity onto your toes. Hold this position for a count of 15, then lower your heels back to the starting position. Perform 20 times. Exercise 3. Rear leg lifts. The rear leg lift exercise. How to perform. Lie face down with your stomach flat on the floor. Lift one leg high to create a 30-degree angle, trying to keep the leg straight without bending the knee. Perform the movement gently and slowly to avoid muscle injury, holding the position for a count of 10. Return to the starting position and perform 15 times. Then switch sides and do the same with the other leg. Exercise 4. Side leg lifts. The side leg lift exercise. How to perform. Lie on your right side, propping your right elbow on the floor to support your head. Your left arm can rest along your leg or place your hand on the floor for support. Slowly lift your left leg to a 45-degree angle. Hold the position for a count of 10, then lower the leg back to the normal position. Perform 15 times, then switch sides and do the same with the other leg. Exercise 5. Air cycling. The air cycling exercise. How to perform. Lie on your back on a soft surface to avoid back pain. Lift both legs high, bending the knees at a 60-degree angle. Push one leg forward and then retract it in a circular motion, repeating with the other leg. Imagine you're riding a bicycle in the air. Perform the circular motion at least 25 to 30 times per set, and do 3 sets with a 10-second rest between sets. Exercise 6. Ankle rotation. The ankle rotation exercise. How to perform. Lie on your back and bend your knee to bring your left leg toward your chest. Use both hands to hold the bent leg. Rotate your left foot clockwise 5 times, then rotate it counterclockwise 5 times. Return to the starting position, do the same with the other leg, and perform at least 15 times. The exercises above are extremely simple. You can perform them right at home or at the office. Not only do they bring clear improvements for varicose vein syndrome, but these exercises also offer many excellent benefits for your overall health. Save this and start practicing right away. If you found this useful, please share it so everyone can know. Thank you for watching and see you in the next video.